concerned about the corners of her mouth turning down, so I'm going to use some fillers to fill the corners out and make them straight. First, I'm going to put some local anesthesia in, and I use some topical first because the patient's very sensitive. I'm trying not to hurt her. I use a very small needle to put some local in so I can get started. So I just put a little entry point with local so I can go in. And you can even add local anesthetic to the filler so that the whole procedure is relatively painless. So now I start by pushing some of the filler in. Again, I'm trying to fill out the corner. Some people call these puppet lines that run from your mouth down towards your chin. But you can see just that little bit of volume, how the corner has sort of straightened out. And it's a very easy way to take years off the face by doing that. Again, to put the product in, again, I'm using a very small needle. I'm just massage it all in so it smooths out. And look at the right side compared to the left. You can already see it. Now I'm going to put some in the angle of the lips. Again, we have older women come in who are grandmothers because the grandchild says, "Grandma, is there anything wrong? You look sad." And they say, "No, little Johnny, I'm not sad. It's just because their mouth turns down." So this really gives a nice touch to the lips. So I'm going to square up this corner. Now I'm going to do this side. Again, I'm using a hyaluronic acid. There are two different types. There are small particle hyaluronics, such as Juvederm and Restylane, and heavy hyaluronics, such as Perlane. Sometimes you could layer a light one and a heavy one together. You put the heavy one in deep and the light one closer to the surface. Now I would say a remarkable improvement of her lips just by doing that. And most importantly, there was not a lot of discomfort, which is very important to me. And I think there's a marked improvement in her lip shape and the more youthful looking face. By the way, you may notice that this patient's cheeks are very full. I have done sculpture on her, and she has a lot of volume in her face. Now let's do the actual body of the lip a little bit. I'll start again in the corner. Add a little bit of product. Hold a little pressure. You know, I think it's important that the patient is comfortable because it's a very artistic thing to do lips. And I don't understand how you could do lips with the patient jumping around and in pain. I'm not in any hurry. I give the patient an adequate amount of time for their procedure. You know, and again, I'm working on the body of the lip a little bit. and you can see the volume. Her lips are starting to fill out. You could come to the Laser and Cosmetic Center, Los Gatos, California, and whichever product that you want we can do for your lips. Some patients require dental blocks, where I actually block the lip on the inside of the mouth, or you could just add local anesthetic to the fillers, and some of the companies are starting to manufacture the fillers with the local in them. Now I'm just doing close to her border, but I don't want to get a duck lip, so if you notice, I'm below the vermilion line just a fraction, because I don't want to get a duck sharp edge to her upper lip. But I do want to turn the upper lip up a little bit and give it some volume. So I just march along. This will give you the opportunity to show you how we can fill your lips to give more volume to them. Actually, lip plumping is a very popular procedure today. It's non-surgical, actually, and it's not permanent, and you can make them as big or as modest as you like. I'm just marching along, relatively painless. Just putting in very small amounts, because we don't want to get bumps in the lip from doing this. But see, there's a volume starting to fill out. It's looking better and better. And oftentimes I'll have the patient look in the mirror to assist me. They may have areas that they think require a little more. This is somewhat complicated because of swelling when you do this, because I know where I've put the product, so I'm pretty sure of where they would need more. Now I'm going underneath the first line a little bit further back in the lip to give more plumpness to the lip. Now on the day following lip injections, it may seem a little bumpy, irregular, but that usually straightens out. The good thing about these products is that we have an enzyme to dissolve. If there's a bump or it's not irregular, we can dissolve it and make it more even. Hyaluronidase. Bumps can occur. We're not sure if it's the patient's musculature can squeeze the product together. I tell patients usually on the night after doing this, try to keep the lips as quiet as you can so the product sticks. In other words, don't eat steak, don't drink out of a straw, try not to talk too much. And usually in a few hours you can put lipstick on and the holes are closed. So I try to balance the upper lip to the bottom lip. I have my ideas of what the lip should look like, but we also respect what the patients have to say. Different patients, some patients may want the upper lip bigger than the bottom, although the upper lip should only be 60% of the size of the bottom lip. Some people want a more pouty bottom lip, which I prefer. But whatever kind of lip you want, we can create for you. Sharon's just holding some pressure on there. But her lips look so much more youthful. Now for a little bit of pout to the bottom lip. Sorry I keep entering the picture, but I like to work from side to side to make sure I get the proper balance. Don't want to put too much in one side and leave out the other one. So I just walk around the chair up and back to make sure everything comes out nice and smooth. And I just massage the product in, especially on the bottom for the marionette lines, to smooth it in. Make sure it's nice and even, no bumps or anything. And there we are.